So how did you end up doing firefighter research on like decon and wipes and stuff?
Oh,
What's the path?
a great question. How did I start? So I did an undergrad in health science. I've always been really interested in health. Um, my health science degree was it was more on behavioral aspects of health rather than the actual science behind disease.
Like human
So
behavior
then,
and yeah.
yeah, like why do people decide to smoke and why do people eat unhealthy? And it was interesting, but I didn't really know what I was going to do with that. And I was always more into the sciences. So then I did a chemistry degree, but that was almost on the far end of it because then it was too sciencey. And at one point I was like synthesizing synthetic chemicals in a lab, and I'm like, what am I doing? This isn't human health either. So then, kind of intersecting the two, came toxicology, where it's kind of the science of how toxins affect your health, or not even just toxins in general, but any sort of compound. So I reached around to a whole bunch of profs pretty much across Canada, seeing like what kind of projects they had going on, what I could work on. And one prof who I ended up working with for probably 8 years had just gotten a grant to work on firefighter related topics. So moved to Ottawa, started doing that. So our first study, we just looked at overall firefighters' exposures. But what was relatively novel at the time was that it was for during emergency fire suppression rather than during training fires, which there had been some studies before, but they weren't as thorough as what we were planning. Sorry. So we looked at air during live fire suppression, wipes of their skin, of their clothing, of their PPE, urine samples at the start of their shift, and then if they went to a fire, a urine sample immediately after. So we would have those paired urine samples from the same day, rather than oftentimes, just because it's way easier, people would get a urine sample after a fire because you knew when that was going to happen. And then they would take a baseline urine sample either a few days or weeks or months later and try to compare those two, which you could do, but it's a lot better to be able to do it on the same day. Then it's for sure before and after the fire. So that was kind of the start of my firefighter research journey. And then after that,
what was your experience just meeting the fire service? And
oh, it was such a whirlwind. I was young. I didn't have a car, so I was biking around Ottawa with urine samples in my backpack and on the bus with a cooler full of ice packs and like 30 urine samples. And life's a lot easier now that I have a car. Well, and I kept joking with them. I'm like, if I'm riding around on my bike, if I get hit by a car and they like can't identify my body, they're going to do DNA testing. I'm going to have like 30 men's urine samples in my backpack. Who is this girl?
Who is this girl? What's she doing in her free time?
What is she doing?
Yeah, there's a lot of...
But it was awesome. Like Ottawa Fire has they've been so good to me and have supported every aspect of my research. And I've always been open for discussion, especially coming in. Like I don't have a firefighter background. I have uncles who are volunteer firefighters, and cousins, but it's not really I'm not that close with anyone who's a firefighter. So I had a ton of learning to do, just what it's like to be a firefighter. When you go to a fire, what do you do and what happens? And the logistical difficulties of trying to avoid exposure, which is a huge aspect of it that you have to incorporate into your research, or else it's just not applicable. So it's been so fun.
So the outcome of the first study was basically looking at what's the exposure levels during the current practices that Ottawa Fire Department had at the time, sort of.
Yeah.
And what was the realization from that?
So we saw one metric that we use to measure exposure. So the one group of compounds that we were mainly focused on are polycyclic aromatic hydrocarbons, or PAHs. So they're a group of compounds. They're formed during combustion. So they're in your barbecue and your bonfires, in smoked foods, but obviously at live emergency fires too. And And several of those chemicals are carcinogenic or mutagenic or teratogenic. So we were really interested in looking at those. So one way you can measure someone's exposure to PAHs is measuring their metabolites in urine. So I equate that to, it's gross, but if you want to know if someone ate corn, you look at their excrement and see if there's pieces of corn kernel. Yeah. So the same thing with PAHs, you look at the metabolites of PAHs in urine as an indicator of how much PAHs they were exposed to before. So we looked at their urinary PAH metabolites, and we saw huge increases after a fire. We knew that they were being exposed to PAHs. We then also looked at their indicators of lung injury. So it's called Clarisel 16 or CC16, and it also comes out in your urine. So anytime you experience lung injury, so smokers have really high CC16 typically, because anytime your lungs experience some sort of injury, they'll excrete that compound and you'll eventually pee it out. So you can measure that in urine as an indicator of lung damage or lung inflammation.
So it's just how long after the damage would you see those levels be elevated?
Pretty soon after. PAHs are within a couple hours. Yeah. I believe Clarisel 16 is as well. So when we looked at that, we didn't see any change before and after a fire. So that made us think, it's probably not majority of a respiratory exposure. It must be something else. So then we also had collected wipes of their skin, and we saw that if there was a relationship between how much of an increase of PAHs there were on the skin and the increase in pH metabolites in urine. So that was our first indicator, and other people had mentioned and published this before. But from our own research, that was the first time that we saw evidence that dermal exposure might be a main route that we should be paying attention to.
So because Otto at that time was probably pretty good at wearing the BAs when they were in and around smoke.
I'd say so from my own.
No, but I mean,
you never know what happens at 4 a.m.
No, did you at least looking at that indicator, looking at lung damage, you at least the theory before that was if they weren't wearing the BA at all, you would probably see those indicators of lung damage.
That would be the theory, yeah.
That would be the theory at least. But you didn't check, of course. You didn't send someone in a container without a BA to verify the data. But it just could be confirm. Just to confirm. Can somebody please die for me?
Yeah.
Okay, so the dermal exposure was that talked about in the scientific community before that as related to these types of firefighting, or?
Yeah, it had been mentioned, but it wasn't as big of a deal as it is now, I would say. Yeah. Maybe it's just from the conversations I've had since, but it seemed like at the time it was more, dermal exposure was a thought, but no one really knew what to do about it.
Yeah.
Which is still kind of the case. So that was kind of where we ended off. So at that point, I had finished my master's, but I had this bug in the back of my head of it'd be really neat to figure out what to do about this dermal exposure aspect. So we ended up, I worked for a year, realized I didn't really want to work as a lab tech. So then we went and pursued more funding to do a dermal decon study. And that's what led us to our most recent study, where we had firefighters. They were signed up to do training fires. So in a CCAN, I think you were at probably the similar fires, the ones at Ottawa's training facilities. Yeah. So those type of training fires. And then, so they would go do their training, and then afterwards we'd assign them to 4 different intervention groups. We want to see if some sort of post-fire intervention could reduce how much PAHs were getting into the body by doing something after the fire. So by cleaning their skin somehow after the fire. So there was 4 groups. One group did nothing, which we called kind of our control or status quo. One group used a washcloth with just dish soap and a bucket of water. And then we had the 2 other groups used commercially available skin cleaning wipes.
Yeah. Firefighter named Decon, multiple in the markets.
Yeah, exactly. We didn't state which ones because I didn't want to get sued, and I got sick. threatened enough for talking about science. I wasn't going to get the wipe companies after me. So I was like, you know what, this time we're going to go anonymous.
Yeah.
Cleaning wipes.
Yeah.
So yeah.
But was it anything specific with this wipe that would make it significantly different towards other wipes on the market, would you say?
I tried to select 2 different wipes that had relatively different ingredients. But I mean, if you look at the ingredient wipes, the ingredients on wipes, the number one ingredient is always water. I'm sure not, like, they don't say the proportions. I'm sure most of them are mainly water. And then they have little bits of other things, which I don't think make a huge difference. But I don't really know. And no one's really studied it to say, I mean, each company has their own claim of why they're better than the other. But there's not really much evidence to prove, why having alcohol or not alcohol or aloe vera or not aloe vera is better than something else, especially at such little quantities.
Yeah. So some commercial wipes, and you do normal baby wipes, or
2 anonymous wipes. Nice try, but 2 anonymous wipes.
So you had those different groups, and the theory was, the thing you want to test was, does it make a difference? So you are exposed during a fire, you get stuff under your PPE, and if we wipe it off fairly soon after, can we reduce the total amount of PAHs absorbed by the body?
Exactly.
Yeah. So first off, before you get into that, so PAHs is just one of many different categories of harmful substances. Why did you select just PAHs compared to other types of particles or liquids or bad stuff?
That's the tricky part of firefighter research, is that you have to just select certain chemicals because you can't measure them all.
No,
analyses are so expensive and huge amounts of time and different methods for each type. So even as part of that study, we were doing skin wipes. We used a certain type of wipe to collect PAHs off of skin. But if you wanted to collect metals or plasticizer or some sort of different chemical, you'd probably have to use a different type of wipe. So it gets very expensive, logistically difficult, time expensive as well. But the main reason why we had picked PAHs is because we know they're present in high quantities during fire events or any sort of fire. And we know that they're carcinogenic. There's a lot of evidence to show that benzoylpyrene causes cancer, as well as a lot of other ones that are having more and more evidence suggesting that they have carcinogenic effects as well. So that's why we were focusing on those. And we know that they can be dermally absorbed.
So would you say, do you think that it's indicative of other substances too that are harmful?
No, because everything absorbs differently through your skin.
Yeah.
There are some compounds that you'd have to leave it on your skin for years before it would somehow find a way to absorb into your body.
Yeah.
I think there's a misconception that just because something's on your skin, it's going to be absorbed right away. But the fact of the matter is, depending on what the compound is, it can absorb within seconds or it can absorb never.
Yeah.
And then there's a whole range in between of hours, a couple hours, 18 hours, and longer. So that's why we want to look at things that we had mechanistic evidence that they can be absorbed through the skin.
Yeah. Okay, so looking at PAHs, you're looking at that different types of decon. First off, did you see any difference between the different ways of doing decon and in terms of how much they reduced PAHs on the skin after?
So on the surface of the skin, the wipes didn't do anything, but the bucket of soap and water with dish soap removed about half of PAHs.
Why do you think there was a difference between the wipes and the bucket of water?
That's the $1 million question. Our theory right now is something to do with the surfactant in soap that's able to kind of encapsulate probably the particles which the PAHs are stuck to. Yeah. Especially the larger PAHs, they don't really exist on their own floating around in air. They're always stuck to a particle. And then that part, like a little tiny piece of soot kind of thing. And that would then float on your skin, and then the PAH would fall off and kind of be absorbed into your skin. That's kind of the thought process of how a larger, more bulky PAH would get into your body. So maybe that soap is better at being able to encapsulate those and remove them from your skin rather than a wipe, which wouldn't have that ability. But we're really not sure. That's kind of just our going theory of why that would be. It could also be a difference in the friction that they're using. But I mean, everyone kind of use it the same way, whether you have a face cloth with soapy dishwater, obviously not dishwater, but water with your soap. Don't use your dishwater.
Scientist says you use dishwater in your face.
Yeah, use your dishwater and it cleans your skin. This is what happens. People spin my words and I sound nuts.
We are evil. We want to clickbait. Because there's a mechanical part of it, like you used a washcloth. Like if you were to instead not use a washcloth with water and soap, you just use like your hands to scrub. Maybe. Because there isn't a mechanical element.
Do you have baby soft hands or do you have really rough hands?
Really rough hands.
That would make a difference.
So you want to have grade 4, what do you call it in English?
Calluses and grossness. Maybe that's really good at exfoliating the PAHs off your skin. I don't know.
So but do you think it's like an indicative? The more the visible soot you remove, the more PAHs you remove?
No, not necessarily, because I guess the larger PAHs are often stuck to those particles, but just because you can't see them doesn't mean they're not there. And then the smaller PAHs, which are more happy to be on their own and not stuck to a particle, you wouldn't see those.
Yeah.
So
and then because of course the follow-up question is that if you're successful removing anything on your skin, for instance with soap and wash, or if you could have the opportunity to just jump into the shower and do that more effectively, and we have this shower within an hour was popular for a while, at least, to get that soot off and all that smelly stuff. Did you see any indicator that would be important to remove PAHs from the urine?
So that was the interesting part. Our first, I was doing the analyses, I saw soap and water removed about half of PAHs. Great. Then I look at the urine results. Everyone has the same amount of PAHs in their urine, no matter what they did.
So that would indicate that those super tiny PAHs is already absorbed before you do the washing?
Exactly. So then I took it a step further and I looked at literature value. So people who have done experimental, like they put in a lab, they took a certain amount of PAHs, they put it on top of skin, usually a synthetic skin, and see how fast it takes, or in an animal model, and they calculate how fast a PAH takes to absorb into the skin. And especially for the smaller PAHs, which is what we measured in urine, it's within minutes. So if you've been in a training fire for an hour, chances are that all those exposures during that hour, you've already absorbed those smaller PAHs. And that's why we're seeing it in the urine. The one missing part that we weren't able to capture is that the larger PAHs, which are the ones stuck to the particles, and they take longer to absorb into your skin. So those, you might have a better chance of removing from your skin and reducing that exposure. But we're not able to measure them in urine because they are excreted through fecal matter. And we talked about doing that, but I was like, there's no way I'm collecting 88 fecal samples. So maybe for a future grad student,
anything
but
for science, but not that.
Too old for this. This is where I draw the line.
It's just okay. I mean, I would die for the country, but you can't even collect fecal matter. No, I'm just kidding. No,
you know what? It's not even me. I think I'd have a really hard time getting participants.
Oh, yeah. Hey, can you shit in a bucket for me?
Yeah, exactly. But I also need a pre-fire sample and a post-fire sample. So you're going to have to push one out in the morning and immediately after the fire. So logistically, a little difficult as well. Yeah. Maybe for someone else.
Yeah.
Feel free to take my idea. Someone else can do the study. I don't want to be involved. I'll consult from a distance.
I mean, at least we know that the smaller ones get through to the urine, and it's probably. I mean, so of course, one the wrong conclusion would be say that post decon is useless, right?
Yes, that would be the wrong conclusion. This is a first step in figuring out what we should do. I'm not saying it's useless, but I'm not saying it's the golden
doesn't
ticket,
solve all problems.
Bullet. Exactly.
Because
which everyone is looking for. Everyone wants this magic solution. It doesn't exist. Stop looking for it.
So we have this is a small one, like you said, and there's first off, if you look at just pHs, the larger ones, this cross contamination. So even if they're on the skin and you don't remove them, you might end up eating them, for instance. Exactly, if you drink water or swallowing them, and then they do get into your body, potentially surviving that environment and getting into your body.
Yeah, for sure.
But it's also at least the potential for those medium-sized pHs to actually be absorbed an hour after or 2 hours after if you do not remove them. And then of course we have all the other toxins that we don't know about, a lot of them that might possibly be removed by wipes or with soapy water. Now, I use wipes all the time. At least it removes the dirty stuff. But as soon as I can get running water, I try to use that. But because I've seen your study and you hear the researchers talk about soap and water being good in other areas compared to wipes and so on. So it made sense from that matter that it is a good thing to do. But at least it gets you the levels of cross contamination down if you remove visible stuff. So I don't think anyone should stop using it. And does it make sense? One thing I heard about wipes was if you use wipes with alcohol, sure, they dissolve certain things to make it easier to absorb in the wipe, but they also open the pores in your skin more so that they potentially go through. You rub them basically into your skin. Would that be a theory that is possible?
It might be, but again, I think the other components in a wipe are in such little concentrations that the chance of them having a significant effect on increasing the absorption of your skin is probably pretty low.
Things temperature is more important of your skin.
Yeah, probably temperature, the time in which you use the wipe. I mean, it's all... Again, I don't really know, and no one knows because I keep trying to look for answers, and there's no scientific literature to support any of these theories. There's some say that aloe vera increases absorption. But if you look at the study that did that, they're looking at 100% aloe vera with a pharmaceutical compound in it and see how that helps, increase the absorption of a medicine on your skin.
Yeah.
So then to relate that to a firefighter skin cleaning wipe, where it probably has 0.1% aloe vera, I'm not sure if it really makes that much of an effect. So
what you're saying is you can take a bath in aloe vera after and it won't make a difference? So that's what you're saying?
No. We talk so much about wipes and showering within the hour. And then I think that next step to that is your behavior on the fire ground. How to teach that and how to encourage that, I don't know, because that's a complicated issue with a lot of differing opinions. But I totally agree with you on that. But then the other aspect of it is, what are you doing with the rest of your life? Are you drinking a lot? Are you eating like garbage? Because at the end of the day, we talk about this stuff because we're trying to reduce illness and disease. But illness and disease doesn't just come from your occupation. It comes from every aspect of your life. It comes from your genetics. It comes from what you're drinking at night, what you're eating, where you live. And I think we need to look more at the whole umbrella of risk rather than just what kind of decon are you using? And that's part of it. And they're great conversations. But I think we often miss the bigger picture as well.
So would you say, I know this is outside your field, but would you say it is possible to mitigate the risks involved in firefighting with other life choices?
It's not so much mitigating the risks, but it's reducing your risks in other parts of your life. So again, my head, everything just adds up. So, you have a family history of breast cancer, and now you're a firefighter, but you also eat like garbage, and you're overweight, and you're a smoker, and your sleeping habits are awful. And, all these little things add up. So things you can't change. You can't change your genetics. There's some aspects of firefighting you can't really change, but we can work on it. But all of those modifiable risk factors, which make up another huge part of your life, we don't talk about.
That makes sense. And I know it's such a hard topic. I mean, everyone has their own opinions on how to eat and sleep and everything, but it's one of the reasons why I've made a lot of changes in my life, going like, I need to sleep more. Like, for instance, that seems to be a big thing, like sleep well and more.
But that's hard. It's hard with your schedule.
Oh, yeah,
if you have a family. Yeah. Like, I haven't slept in like 3 years. And I'm not a firefighter. I have a very normal job. So
no, but it is hard. But it is a realization that it is accumulative. It's the different things, like how to damage your DNA and how that's get damaged and how it can be repaired by the body. I think that fasting is a way to actually make the body heal better. There's a lot of research into that. There's a lot of things that you do. Not eating processed foods is probably good for you in terms of not being able to.
Yeah. I don't even like to nitpick at it. It's just everything in moderation. Like, you want to have a beer on a Friday night, have a beer. But then you want to have some chicken wings, sure, have some chicken wings. But maybe toss in a salad once in a while and eat some cucumbers and, drink some water instead of your diet Pepsi or whatever. Like,
so you say
water.
drink on Monday, and then you chicken wings on Tuesday, and then McDonald's on Wednesday. Then it's all good if I just rotate those things.
No.
No, I'm just kidding. No, it is. No, I think there's a balance. Like it's one of the someone told you it's about health. The objective is not to maybe live as long as you can, but to live well and long. So there's probably moderation, yes. But I do agree, because for me, an instructor, first on a personal level, of course, I want to be healthy for my family. I want to keep doing this job. But it's also, as an instructor, I get always these questions about, we want to shut down our live fire training program because of health issues or concerns about health issues. Go like, well, you're training. I understand you want to reduce exposure risks, and I think we can manage those. And you want to add other risks by not, because this is not your error, but I don't think there's a good substitute for carbonaceous training, creating that smoke. If you don't have good training smoke, you're missing out on a large part of how do you practice to do risk assessments,
the physical risks of the job.
So then you're training one risk versus the other, and of course it's hard. I fully understand for managers to do those risk assessments and saying, okay, so if we reduce risk of exposure, which seems to be an apparent risk, what kind of other risk are we taking on, and how do we balance those? Because we, of course, as an employee, they have a duty of care towards their employees. Mm-hmm. So it is hard, and I get those questions a lot. And I go like, I can from a fire training perspective make the argument why smoke is important, for instance. And smoke is, of course, the big issue. You can try to make the smoke less toxic, but it's not going to be nice. There's no clean smoke, which would be awesome if you're just dirty, but non-toxic smoke would be awesome to have. But right now we don't have a viable way to do that. So it's still necessary. And then the behavioral pieces, of course, come in. How can we mitigate? How can we manage those risks? Now, I am the first one to, when I was sitting as a battalion chief, I was getting this, we're just going to put washing machines everywhere, and we're just going to put overpressure in our fire station. Everything was about buying and modifying stations and everything. There was no single piece about behavior of the individuals. And I saw, not just in Sweden, all over the place, departments buying a lot of expensive equipment for washing things and cleaning things, and creating overpressure in some areas of the fire station and so on. Massive investments sometimes. And the fire was going out to the fires, and they were not wearing their particle mask. They were not wearing gloves under. They were taking the gear off, not putting it in a separate place, going somewhere else. And admit it, I do it wrong too. But like it is, unless you solve the behavioral problems about this, just a lot of times come down to being lazy. Then the other things are go like it doesn't ring a nice bell to have the taxpayers pay a lot of money for that unless the firefighters actually care about changing their own behaviors.
This is so nice to hear. I have gone on this exact same rant so many times for this exact reason, because everyone just wants to throw money. Everyone, oh, wipes work. Let's go buy wipes. Let's buy, a washing machine for our SCBA, and let's buy a washing machine for this. And can we just stop for a second and take a step back and look at everything? Let's look at fire behavior on the ground, at the station, like everything you just said.
Yeah.
I can't agree more. We have to take a holistic approach to this and stop individualizing all the separate issues and start looking at more as a whole. But a behavioral aspect are so tough. Everyone says, I'd rather have a building issue than a people issue, because people issues are so hard to solve. And I don't blame them. And it's the same for every job. Behavioral issues are the toughest to change. And maybe that has to come from the individual. And it's hard to be able to communicate that with people because everyone has their own opinion. Talking about avoiding smoke exposure by not necessarily changing tactics, but changing your behavior on the fire ground.
Yeah.
But oftentimes you bring that up and people say, well, if you don't want to be exposed, don't be a firefighter. And that's kind of they just shut down the conversation. I'm like, but no, I'm not saying,
not saying you shouldn't rescue people.
Like, of course, please. If my house is on fire, get your ass in here.
No, but I think I fully agree, because I work. It's not on my baseline, but if you have a perspective when it goes to firefighting, if it's good for people we rescue, it's good for me. Meaning, if we reduce exposure to people which are acutely exposed, we will reduce exposure to us too. Like it goes hand in hand a lot of times with reduced exposure. And it goes hand in hand how you should operate. You should stay low, because the lower in the compartment is less toxic. You should ventilate as fast as you can because you want to get rid of the smoke for everyone, and so on. There's a lot of, and I think that there's tactics and methods that benefit exposure that also benefit many other pieces. And that is for sure a problem everywhere. And we're struggling with in Sweden too. Look, we crawl around buildings just because we want to practice on search rather than practice on rescue people, which are two different things in my head. So behavior part is a huge piece. And I remember I said to one of the big proponent of buying things, I said, when you start changing your behavior, I will start buying things. Like it was at that level, go like, I'm not going to take you serious unless you can actually demonstrate that you actually care on after a training or something, that you actually do wear your particle mask when you decon, or that you do wear proper gear, or that you do walk away from the smoke when you're standing in it, and so on. If you don't, like all the washing machines in the world, that's going to make a difference. Not to say that you shouldn't wash your gear and so on. That is important too.
Exactly, and that's the caveat.
And that's a different. I'm going to have this different conversation now about washing gear and so on, which is interesting about CO2 washing and so on. So will you do? Do you know if they're going to do anything other fire related, or are you done with the fire service now? Yeah, have you had enough?
I've wrapped up my life in academia for now. If anything else came up, I would be open to it. The fact of the matter is there's not full-time jobs in firefighter research. A lot of it's research based as a student, unless you're a professor. And I don't want to be a professor, at least not at this point in my life. So for now, I'm tapping out, but maybe in the future, I'd love to get back into it. I mean, and there is it's kind of an interesting time to be part of the firefighter research world, because so much has been done. So the future is, I think, going to be a lot more practical aspects of what should we do. We know there's a problem, and we've done all the research behind that. But I think the research going ahead is going to be what is actually effective at reducing exposure. And I'm hoping that it spans more than just chemicals, like we were talking about before. It'd be great to get some research on behavior And there is some really cool research coming out of the US on lifestyle, on drinking habits and eating habits and obesity and stuff like that. So I'm hoping that that firefighter research spans more broadly, and we can maybe get some other experts in the field, like talking all this talk about behavior. I haven't met a single expert in human behavior at any of these firefighter conferences, or someone who knows how best to teach how to change behavior and how to change habits. I think having someone like that in the field would be really interesting, because, you and I, we have theories of what would work behaviorally, but how do you tell that to someone? Like, it's the art of trying to teach someone what they should do without sounding condescending or without getting their back up against the wall. It really is a fine art, and I don't have it. I'm too blunt and I don't have the patience for it, but I'm sure there's someone out there who knows how to approach that topic in the correct way so that people are more open to change.
So what would be the low-hanging fruits, do you think, for research? If you were to give them like $1 million to start or for that matter, 15, what do you think are the low-hanging fruits, looking at what would make a difference from your perspective to reduce cancer in the fire service as a whole?
I think what would be really interesting, I don't know, it's not necessarily low-hanging fruit per se. You can make a joke about this, but reproductive toxicity and how your exposures. So how your exposures are for both male and female firefighters, how your exposures are affecting your kids, are affecting your fertility rates, are affecting the genetic makeup of your kids. Because there's been a lot of animal studies that show that PAHs can affect the sperm of men. And then there's all this kind of word of mouth conversation about infertility in the fire service. And there are a couple studies actually out of the US that looked at like miscarriage rates and low birth weight in female firefighters in the US. But there's so few studies. So to have, I think that field of research would be really interesting and would maybe calm some of the concerns. Maybe it's not as bad as we think it is, or maybe it is an issue and we need to think about how to mitigate those issues if it really is a problem.
I was actually surprised when you say that. In Sweden, as long as I've been in the I think for 20 years I've been connected to the fire service, I think it's been if a female firefighter gets pregnant, she gets put out of service. She can't go to fires by law. And I was surprised. I don't. Yeah, go on.
Well, see, that's where it gets tricky, because a lot of the development. I mean, there's so many things to talk about here.
It starts way before that. You're getting pregnant, yeah.
Well, not even that, but okay. So from a female perspective, the first few months is when a ton of the development is happening.
Yeah.
But even I'm getting ahead of myself of when there's actual pregnancy, but even beforehand. So there's been work that looks at what happens to sperm when you get exposed to PAHs. And the effects of that. And there's been a lot of animal studies that have looked at that and have seen effects. So I think to look at that in male firefighters would be really interesting and would provide some insight. Like the theory is, in theory, it's not a theory, but my theory. So when a male firefighter is exposed to a bunch of mutagenic substances, so some PAHs are mutagenic, it can affect the genetic makeup of the start of a sperm. But then it takes, I forget how long it is, something like 60 days for that cell to become an actual sperm. So in theory, if we studied it well and we knew the mechanisms of it, maybe when a firefighter goes to like a big nasty fire, maybe we say 60 days from now, if you're trying to conceive, maybe don't conceive around then. Maybe wait until you have cleaner sperm from a day when you weren't exposed to a big nasty fire.
Yeah, that's not going to work in the fire service. But it would be, I mean, like an alcohol, like if it were to be, I mean, that if it were to show that firefighters have, for instance, decreased fertility rate or damaged sperm, which in that case will get damages transferred to the DNA of the kid or some, different things.
Or cause infertility or issues with fertility.
Yeah. But one of the issues we of course brought up is, if I become a firefighter, I get to put sperm in a donor bank paid by the government, paid by the city, so that when I want to have a kid, I have freshly uncontaminated sperm at hand. I'm not saying that
it was a huge issue.
Yes,
but we
I'm
don't
not
even
saying
know. We
it
know
is.
nothing about it because no one studied it.
No, but it was that's the data that you need to be able to know if it even is a problem, because we are only scratching the surfaces what those chemicals are doing, and of course it's going to be really hard to prove that it is that is the cause and not all the other aspects of life, which is of course the problem with cancer in the fire service. That how do you prove that it is actually linked to firefighting? Not you smoking or you drinking or you just being gifted with poorly concocted genes. It's very hard to do.
But especially with fertility as well, because just infertility in the general population is high. I don't know the stat. I think it's 1 in 4 or something like that. 1 in 4 couples trying to conceive are having issues.
Yeah, I've heard that plastics and phthalates and stuff like that is a huge concern in terms of reducing sperm count and stuff like that. Who knows? Yeah. But going back to that issue, because if it isn't not possible to just look at existing firefighters, looking at and compare that to general public about the healthiness of firefighters' sperm in general. If you look at male, just do comparison.
Sorry, you froze for a second.
Isn't it just possible to do a comparison between active firefighters and the general population about the healthiness of the sperm? If you do a large enough sample, wouldn't that be indicative of something happening?
Yeah. Why hasn't anyone done it?
Yeah, I know. The first thing, people have to ask the question. I mean, that is,
and I have talked about it with experts in the field who do this kind of research all the time, and it's on their radar. I think it will hopefully come out at some point. I think for me, when we're having these conversations with the other researchers, what's tricky is how do you communicate those results to someone without causing them to freak out? Because we all have genetic mutations.
Yeah.
And, you don't want to give someone back their results that say, you have a really low sperm count and it's full of genetic mutations. And just because you have genetic mutations doesn't mean your kid's going to be full of genetic mutations. It's all how that genetic information between you and the other person come together to form that kid. So it just gets very complicated. And there is a way to do it because people have done these types of studies before. It would take a lot of specific planning and doing it in the right way. But also it'd be really valuable information that I think would be really helpful to people. Is this actually a firefighter problem, or is this just a general population problem that we're all dealing with?
Hard to know. But at least now we know that we shouldn't put much emphasis on deconning, that will not solve the entire problem of firefighter exposure. At least we know that.
I think, you know what? I'm going to dream about the rant that you just went on when it comes to buying stuff versus behavior, because I have gone on that rant in very less elegant ways. And I couldn't agree more.
So to start with a question we have discussed before, or we brought up before, which I know you love, the topic of saunas. Because in Sweden, every fire station has a sauna. It was used to create heat tolerance for firefighters. Which is a lot of the research. After physical exercise, you go into the sauna, and that helps with heat tolerance. And there's general health benefits of doing sauna. So it's probably a good thing to have a sauna. There's a lot of health reasons. Now that morphed into, anecdotally, a way to decon after a fire, because you go into a sauna after a fire, you smell less bad, which the partners of the firefighters loved. Hey, I can't smell that you've been to a fire. You had to take a sauna. You have to have been having a sauna. Now, the theory of deconning, because there's very little science, I've heard rumors about science, but I've not seen it yet, is, of course, you open the pores by heat, and that could let stuff in, or you open the pores and that pushes things out, or anything that's already been absorbed doesn't make a difference. It's not like you're sweating out PAHs through your skin. That's been absorbed by the body. What's your thoughts? I know that you've not done research on it. Just your personal thoughts on saunas for decon.
There is zero evidence to show that you can't detox your body through sweating. It's a fact. No one likes to hear it, because if you believe in it, you're a believer. But the fact of the matter is, you look at the science, it doesn't make mechanistic sense. Once something is in your bloodstream, you're not going to sweat it out. It's your kidneys and your liver that detox your body. So get it out of your system, or get it out of your head that you can detox your body in any other way. Just let your body do its job. And there's studies on sweating in saunas, but they're poorly conducted and they make no sense scientifically. So that's all I'm going to say about saunas. I've ranted about saunas before, and I've had someone come after me to threaten that they're going to sue me if I keep talking about it. So I'm done talking about saunas. I've told people, if you want to hear what I have to say, you can listen to it. But a lot of people they believe in what they believe, and they don't want to hear a scientist's perspective of it. So if that's your perspective, that's great. But don't ask me the question if you don't want to know the real answer to it. Not you, but just people.
Yeah, I know. No, I think my stance right now, I think that every firehouse should have a sauna, but that's not because of decon. That's because it's good for your health. I think it's a health tool. I think it is.
Well, there are some studies, some well done, valid studies that have shown other health benefits to saunas.
Yeah, you're stressing your body. Yeah,
there's also risks to it as well. So.
Yeah, but if you're not fit enough to be in a sauna, you should probably not be a firefighter at all.
Well, that's a whole other issue.
That's a whole other issue. Yes, but I think like anecdotally, I think it makes perfect sense when you study that it should be hard to, or impossible even, to sweat out whatever toxins you have in your body. But it might be anecdotally, since we know that is the case. Anecdotally, it's just a way of cleaning the body's skin, which has nothing to do with decon. It's just nicer. It's a way to actually get rid of something physical that doesn't penetrate your skin. That's easier to remove if you take a sauna, because you heat it up and for some reason, you're sweating and dissolves whatever crap is on your skin. Because it actually, the anecdotal, it's not something that thousands of firefighters made up, that you do smell less after you take a sauna. But that doesn't mean that it's good for you, because if nothing else, where does it go in the sauna? Well, that's the question. If there's something that's at least loosens from your skin that smells bad, it goes into the sauna when you're sweating. So you should probably sit on a towel and throw that in the washing machine. Now, is the towel now contaminated? I don't know.
But now you're splitting hairs. It's too much.
It's too much. No, I mean, it is, because in Sweden it's such a big part, and I get it. I understand your stance on saunas, and the question is because I get probably once a month I get a email at least about saunas, because they want to have evidence. They basically want saunas and they want the evidence for it working, because Sweden has saunas, and I can't provide them with them to it. Besides the anecdotal piece, which I just have, this is just anecdotal. It might even be that it makes it worse. Who knows? Mm-hmm. That to take a sauna after exposure. But it is a question that always comes up. Thank you, Jen. I hope that you get to do something more in the fire service, so that we get to
me too.
To connect again.